Hi, my name's Liz and I am currently a nurse. I'm going to become an oncology nurse practitioner. I'm from North Attleboro, Massachusetts. I went to school down in Philadelphia, Pennsylvania, and then I moved to Houston, Texas to get my first nursing job. After a couple years, I became a travel nurse, and I'm currently working as a travel nurse in Seattle, Washington at Seattle Cancer Care Alliance. I've been here about 6 months or so, and I am planning on moving to Boston, Massachusetts for my next assignment. So my day-to-day life looks a little different right now. I'm working as a clinical nurse coordinator, which is a bit different from bedside nursing or working in an infusion center or something like that. Instead, I work with a team of doctors, nurse practitioners, physician assistants, and medical assistants to help provide care for our collective patients. So what that looks like is I go into the office and educate patients who are in clinic on new medications they're starting, chemotherapies, symptom management, and whatever other nursing expertise they can use. I also call patients throughout the day to check in on how they're doing at home, and I receive calls from patients who are having various symptoms and in need of further education or assistance. I absolutely love what I'm doing right now. I love working as part of a true healthcare team. The doctors and advanced practice partners bring so much expertise to the table to really provide great care for our patients. And then I, as the nurse, am entrusted in making sure that a lot of things get done in between patient visits, and a lot of coordination is able to happen. There are so many things that require the expertise of a doctor or nurse practitioner, physician assistant. But then there are also things that require nursing expertise, and so I think it's really great that we are able to come together as a healthcare team to provide the best care for our patients. So I chose to go into healthcare because I absolutely love helping other people. I know that going into the hospital or a doctor's office is often a really scary time and not patients' favorite thing to be doing by any means. I just have always wanted to provide the best care possible for patients and improve outcomes, and make it the best and least anxiety producing experience for our patients. Working in oncology has been so great. I love working with my patients who are diagnosed with cancer and helping them get through chemo or whatever other cancer treatments that they're receiving. It's my patients who really push me and inspire me to be the best healthcare provider I can be. I want to make sure that every patient is able to receive the best care possible. Something that I've become really passionate about over my years in healthcare is reducing health disparities for patients who are non-English speaking. There are standards in place right now requiring that patients have access to medical interpreters, but there's a lot of disparities in access to educational materials and being able to easily report symptoms and message your healthcare provider. If you don't speak English, don't read English, or don't read at all, this should never determine the quality of the care that you receive. And so I just really want to work towards closing those gaps. As I said, I'm currently a nurse, but I'm working on becoming a nurse practitioner. I'm enrolled at the University of Pennsylvania School of Nursing and entering my first year of my MSN in the Adult Acute Nurse Practitioner program. I'm choosing to advance my career in this way because I want to care for my patients on a different level and be more involved in determining the treatment plans and course of care for my patients. I have invaluable experience of being a nurse and seeing the oncology world from that side of things, and so I want to take all that I've learned and put that into my practice as a nurse practitioner. In 5 to 10 years, I hope to be working at an oncology clinic and providing exceptional care to my patients. I hope to make a difference at my facility in reducing the healthcare disparities for non-English speaking patients, and to become an example for other facilities because all patients deserve equal access to care. I hope this video gave you a little insight into who I am as a nurse and future nurse practitioner. Please consider me for the new ICONS grant to help me pursue my degree and continue to advance the field of healthcare. Thank you so much.